This class is designed to begin a discussion on to distinguish between the existing approach to the COVID-19 pandemic and a socialist approach. We'll be looking at historical information related to the writings of Karl Marx and Frederick Engels. We'll discuss a little bit about the history of pandemics in the last 6 centuries in both feudal and capitalist societies. Just a brief discussion. And also, finally, to look at what socialist countries have done over the last few months in regard to the situation involving the COVID-19 pandemic. We know, for example, that the United States today has more cases than any other country in the world. And this is often not really appreciated by the existing administration in Washington, D.C. In what was their daily briefings, which they have paused recently because they were starting to politically backfire on the president. But even according to the statistics that we are fed every day, right now in the United States, there are over 1.2 million cases, confirmed cases of the coronavirus pandemic. Now, we say confirmed cases because many people have not been tested. And the fact that they have not been tested can skew the actual facts involved in the current situation. Now, we know, for example, that under the capitalist system, the major motivation for social life, economic life, and cultural life is the maximization of profit. And this, of course, has permeated thoroughly the healthcare system in the United States. It's largely a privatized healthcare system, and this is causing tremendous problems in regard to the response to the pandemic. Now, at present, as I mentioned before, the United States and other leading capitalist imperialist states are experiencing an infectious disease outbreak on a scale not witnessed in over a century. Now, there have been numerous epidemics and pandemics since the 1918 through 1920 influenza disaster, which is often referred to as the Spanish flu. Well, in fact, it was not the Spanish flu. The flu, as far as historians and epidemiologists or historians of epidemiology have discerned, began here in the United States among the United States military during World War I. The outbreak, particularly in 1918, as devastating as it was not reported by and large by the US media. It was covered up because they felt it would interfere with the war effort of World War I. Spain, which was neutral during World War I, covered the influenza pandemic in their media. And as a result of that, it was tagged as a Spanish flu. But as far as most historians are concerned, in all likelihood, it originated in the United States. It had a profound impact on the outcome of World War I. And we don't have time to really get into that. But needless to say, a lot of people died from the influenza pandemic during 1918. both in the United States as well as in Europe on the battlefield as well. Now, it's interesting that some of the photographs from this period from the National Archive and other sources have been released in the last few weeks. It's quite interesting. People could look at those photographs where you see people wearing masks on a mass level, whether streetcar conductors, public safety officers, healthcare workers, children in schools, etc. So this whole concept of wearing masks, which previously have been characterized as something alien to the United States, something from Asia, it's not accurate because a lot of these issues have been covered up. The fact that it was covered up by the US press in 1918, in many ways, it's been covered up by historical studies as well. Now, there have been pandemics since that time period as well, and even before that, even here in the United States. And in terms of the influenza pandemic of the 1918-1920 period, it's been estimated that some 675,000 people died as a result of that. I've heard oral histories from my own family talking about how whole families were buried during that period of the outbreak. It was very, very devastating and disastrous right here in the United States. Now, considering the advances in scientific research and medical practice over the last century in the United States, along with the rapid economic development of the country, the general assumption has been by those who live not only in the United States, but also in other Western capitalist states, that these types of rapidly contagious and pervasive illnesses were a phenomenon of the past. Events over the last 2 months in the United States, in Britain, which has more cases than any other country now, in Europe, Italy, heavily impacted by this, Spain, France, Germany, etc., reveals that the potential for a widespread healthcare dilemma such as this has social, political, and cultural implications which could render countries and whole geopolitical regions into severe recessions and long-term financial depressions. We saw yesterday the unemployment statistics indicating that over 14% of the US labor market is unemployed. Well, in fact, it's in all likelihood much higher than that, because it's going to take time for the figures to come in because of the bureaucratic obstacles to the application and of unemployment insurance. A lot of people cannot get through to file claims for unemployment. So that figure in all likelihood is underestimated. It's been reported that some 34 million workers have been thrown out of their jobs over the last month and a half since the pandemic hit the United States. Just think about that, 34 million people. These are depression-like figures and statistics. Now, the capitalist system in the United States has been thrown into a profound uncertainty. In just a matter of weeks, this has been stemming from the incapacity of the healthcare institutions and the social safety nets to adequately address the magnitude of the existing job losses and the inevitable destabilization of people, which will occur through evictions and other forms of dislocation. Now, these developments will create additional threats to public health. I mean, anytime we're going to have people being evicted from their homes, their apartments, or under threat of eviction, of course, this is going to impact the mental, psychological, as well as physical health not only of households, but whole communities, municipalities, and sectors and oppressed nations within the United States. So the problem could potentially magnify itself and expand rapidly. Now, the question we need to address is how will this crisis be brought to a satisfactory resolution? I mean, that is the real question at this point, that the government needs to be contemplating, and we, as a class, as oppressed people, as a revolutionary organization, this is what we need to be thinking about. Also, can the existing system of capitalist relations of production provide solutions to the contemporary situation and the possibility of future pandemics, which could be less severe or even more pervasive than what we have with the COVID-19 pandemic today? I mean, it portends much for the future. Now, these questions can only be answered through the utilization of historical materialist methodology, where we need to examine the actual events and the class forces in operation at any given time period in history, and to take these variables fully into consideration. Now, this undoubtedly represents a stark contrast to the way in which the existing crisis has been approached by the ruling class and also by the capitalist state in the United States. Now, the first citation I want to for us to reference, and it's significant because Karl Marx and Friedrich Engels, when they began as historical materialists, and as they developed dialectical materialism as a methodology of analysis, during the 1840s, the mid-1840s, it was at the dawn of the advent of industrial capitalism in Europe. Now, one of the early essays of Karl Marx is entitled The German Ideology, and I have a link to it in the Facebook page for the event that we're doing right now. Now, this essay was published, I believe, in 1845. It was at the dawn of the ascendancy of industrial capitalism in Western Europe. Now, if people can open up that link, let's see if I can open it up and try to share it on the screen. Do people see the link in the Facebook page?
Yeah. Abiyumi, if you want to try to do the screen share, it's at the bottom. Just click on share screen.
Okay.
If you have that link open,
yeah,
then click the button, and then there should be a few different options. One of them will look like your web browser, just the full page of your web browser, and you can just click that and then do share screen.
Now, to share the link on Zoom, could I just paste it in?
Yeah, you can go to the chat window and just paste it into the message area.
Let's see. Share it.
You know, we could read it on our phones if it would be easier.
Okay, that's good. All right. Well, I just wanted to quote to start out.
Abi, do you want me to
Yeah.
share my screen? I have it on my screen.
Okay, yeah, go ahead, do that, please.
All right, can you see that?
Yes. Okay, I'm going to read this portion, and then we can stop if there are any questions or reflections on this. It says, and I quote, "The premises from which we begin are not arbitrary ones, not dogmas, but real premises from which abstraction can only be made in the imagination. They are the real individuals, their activity, and the material conditions under which they live, both those which find already existing and those produced by their activity. And the material conditions under which they live, both those which they find already existing and those produced by their activity. These premises can thus be verified in a purely empirical way." It goes on to say the first premise of all human history is, of course, the existence of living human individuals. Thus, the first fact to be established is the physical organization of these individuals and their consequent relations to the rest of nature. Of course, we cannot here go either into the actual physical nature of man, and we should say humanity in the 21st century, or into the natural conditions in which humanity finds itself, whether it's geological, hydrographical, climatic, and so on. The writing of history must always set out from these natural bases and their modification in the course of history through the action of humanity. Human beings can be distinguished from animals by consciousness, by religion, or anything else you like. They themselves begin to distinguish themselves from animals as soon as they begin to produce their means of subsistence, a step which is conditioned by their physical organization. By producing their means of subsistence, human beings are indirectly producing their actual material life. Now, the reason I started out with that was to raise the issue of what makes us human. The fact that we can utilize material reality to transform our own conditions under which we live. We can build homes. We can, of course, develop skills. We have disciplines that have been developed throughout history. Education, medicine, the arts, etc. And this is what distinguishes us as human beings, that we have a direct interaction with nature and with material reality. So as problems present themselves within the course of human history, we have the capacity to solve them. For example, disease. We don't have time to go through the whole history of the practice of medicine in Western countries, but for many years, a lot of it was governed by myth, was not based upon scientific inquiry. So when we approach the whole issue of COVID-19 as a pandemic, we're approaching it from a scientific perspective, both from the standpoint of natural science as well as social science. So in doing that, we recognize that this phenomena that we're facing right now in terms of a pandemic, there have been pandemics throughout history. And this is not something that is unique to humanity. We've faced these challenges before. And I just wanted to briefly just discuss, for example, in the 14th century, in Europe, there was a so-called Black Plague. And of course, the reason why it was called Black, I don't think it was necessarily racist, because when people were infected, their lungs would rapidly degenerate and turn black. Now, this disease spread rapidly during the 1300s, the mid 1300s in Europe, and it's estimated that half of the population on the continent of Europe died as a result of the so-called Black Plague. This same similar illness developed in the 17th century in England and also killed a lot of people there during the 1600s. Now, these rapid spreads of infectious disease, often with fatal consequences, did much to transform the character of human society in the 14th century as well as the 17th century. If we notice, after the 14th century, beginning in the 15th century, the whole character of European society shifted. We had the rise of mercantilism very strongly. Also during that century, the 15th century, beginning in the mid 1400s, the beginning of the Atlantic slave trade by Portugal and Spain. Also, the advent of colonialism in Africa began during that. First in the Mediterranean, with islands in the northern part of Africa. Then eventually, by the end of the 15th century, we had the development of colonies in places like Mozambique, Angola, Guinea-Bissau, etc. So the advent of these disastrous pandemics in the 15th century altered the relationship between nations, first interstate relations as well as intrastate relations as well. And there's no reason not to believe that what we're facing today, going into the third decade of the 21st century, will not have altering effects. We already see right now, just in a matter of 2 months, how cultural life, economic life, and political discourse has been shifted right here in the United States so rapidly that we're grappling with how we're going to move forward. Even on the left, we have to adapt new methods, new technologies for organizing and doing mass education. Now, back to the 19th century, Frederick Engels, who was a close collaborator of Karl Marx, wrote extensively on the social conditions prevailing among working people in England. He wrote on this from the mid-1840s all the way through the 1870s. There's one book called The Conditions of Working People in England in 1845. He also wrote extensively on the housing question. And today, in the city of Detroit, but not just in Detroit, throughout the United States, the housing question under capitalism is still a very relevant issue. We've been talking about it for years. The Moratorium Now Coalition was built around the impact of the Great Recession on housing in the state of Michigan. And there have been other coalitions that have been set up around the United States and also in Europe to deal with this very, very important question. Under capitalism, and we've discussed this for many years, the main motivation is the maximization of profit. Workers are given or allowed enough to reproduce their own subsistence. But the contradiction is when the imperatives of capitalism contradict or contravene with the necessity of workers to live and to sustain themselves or to reproduce themselves and their families, then of course, more and more is going to be taken from the working class. We see that happening very, very clearly today. So as it specifically relates to the housing question, which has been a focus of ours for many years, these concerns will become even more and more paramount as tens of millions of workers are faced with the loss of jobs and the inability to pay rents and mortgages. Although the federal government, under the Secretary of Housing and Urban Development, who's from Detroit, but who's a right-wing Republican agent, has claimed that there is a moratorium on U.S. secured housing purchases, like under Fannie Mae and HUD and those agencies. These measures are not indefinite. And with the pressure by the White House and the capitalist system to, quote, go back to work or, quote, reopen the economy, we know that these moratoriums will expire very, very soon. And of course, it's not been articulated in their policy enunciations about how they see moving forward in the next 3 months, 6 months, 1 year, 2 year, etc. Because the economic conditions don't appear to improve, that they're going to improve in the immediate future. Now, the instability that's been generated by the COVID-19 pandemic, in all likelihood, will not be recorrected within a matter of weeks or a matter of months. President Trump has said, well, people just need to go back to work and everything will be fine. The degree to which the virus has penetrated broad sections of the population in the United States means that the potential for ongoing waves of outbreaks remains a serious threat. We're looking at 1.2 million confirmed cases. There are only 340 million people in the United States. That's a pretty high rate of infection in a so-called advanced Western industrialized society. So this virus will remain a threat here in the United States. Now the second citation, well, let me just stop here and find out if anybody wants to make any comments or they have any questions before we have a quote from Ingalls on the housing question. Does anybody want to say anything?
Abiomi?
Yeah.
Just a couple of additions to what you were talking about in ancient times or pre. One thing about epidemics, treatment was developed in the Muslim world for smallpox called variolation. And what it was is it's similar to vaccination where you impregnate a small amount of but you took the actual smallpox germ and put it into a person via like a needle or something. And that was brought over from the female English ambassador to the Ottoman Empire to England and Europe, and played a major role in the history both in Europe and the US. And from that was developed the technique of vaccination later on by Jenner. And also the indigenous people in the Americas were really, there's a book called 1491 that presents how the indigenous people were so vulnerable to the various diseases developed in Asia and Europe and Africa from animal husbandry. And the only domestic animals they had in the Americas was the llama. And the people that came over from Asia were a small group. So their genetic codes had no protection from many very common diseases. So like 90% of them were wiped out when the Europeans arrived in the US. I'm done.
Well, thank you so much, Chris, for bringing that up.
Okay.
This is very, very important. A contribution to our discussion today. When you mention the role of infectious diseases, particularly against indigenous people in North America, it was a major factor. And a lot of it was precipitated by the removal of the indigenous people as well. We look at smallpox outbreaks and the devastating impact that it had. Some say it was even deliberate, that these infections were spread among the indigenous people. I'd also want to mention that even in the United States, among broad segments of the population during the 19th century, there were epidemics. For example, the yellow fever epidemic that swept areas in the South during the late 1870s that wiped out a lot of people during that time period. Ida Wells Barnett, who was the legendary anti-racist and anti-lynching fighter and civil rights activist, many people in her family in Mississippi after 1878 were killed by the yellow fever epidemic. Her grandparents and parents, and she wound up moving to Memphis, which was close by, in order to get away from the impact of the epidemic. So yes, these are, of course, byproducts of Western societies, whether it's feudal, whether it's the capitalist system, which Marx wrote about. And the next quote, if anyone wants to read
Oh,
the
Erin
English
had
quote,
her hand up, by the way.
Erin has her hand up.
hi, Abiomi.
Yeah,
I
go
would
ahead.
just like to talk a little bit about, it seems, you know, when I saw this video on the 1918 epidemic, it was on PBS,
Yes.
and I tried to understand, was there any change? I was just looking for changes in racism. And because so many people died, I was thinking maybe something new could have happened. And I couldn't find anything. And then I thought about after 1918, and I can't seem to find any changes in the society from all those people dying. And when you talked about the the um, the Black Plague and then what went on in Britain, it seemed that you were. I'm wondering, were you making the assumption that that changed society, or you were just talking about society changing at that time?
Yeah, I think both. Yeah, I think these traumatic um, occurrences historically do have an impact on society. It may not be clear at the time exactly what the outcomes will be, but yes, I do believe that the historical records bear out that they will have an impact on how society is organized and how things are going to move forward. At this time, I don't think it's clear. We are pushing to better society. And that's why we oppose the existing policies of the US government, how they ignored the outbreak initially. Today, they're blaming China for the pandemic, but that does not take away from the fact that the majority of cases overwhelmingly are here in the United States. And still does not take away from the fact that the pressure to force people to go back to work could very well create even greater problems. And the scientists have been saying this, but this contradicts with the capitalists in their efforts to reactivate their profit-making capacity.
Thank you.
Are there any other questions or comments? Okay, the next section was written by Engels in 1872. And if people can click on that link, it starts off, it says in the section on the Proudhonist solution. Does anybody want to read that? It's about a paragraph or two, and we can discuss it.
Sure. I can read. You said in the section on the Broadhunters
Yeah, right.
solution?
Yes, go ahead.
Alrighty. In the section on the Proudhonest solution of the housing question, shown how greatly the petty bourgeoisie is directly interested in this question. However, the big bourgeoisie, also the capitalist class, also very much interested in it if modern natural science has proved that the so-called poorer districts in which the workers are crowded together are the breeding places of all those epidemics which from time to time afflict our towns. Cholera, typhus, typhoid fever, smallpox, and other ravaging diseases spread their germs, the pestilential air, and the poison water of these working class quarters. In these districts, the germs hardly ever die out completely, and as soon as circumstances permit it, they develop into epidemics and then spread beyond their breeding places, also into the more airy and healthy parts of the town inhabited by capitalists. Capitalist rule cannot allow itself the pleasure of creating epidemic diseases. The consequences fall back on it, and the angle of death rages in its ranks as ruthlessly as in the ranks of the workers. Frederick Engels continues saying, this fact had been scientifically established, the philanthropic bourgeois to compete with one another in noble efforts on behalf of the health of their workers. Societies were founded, books were written, proposals drawn up, laws made and passed, in order to close the sources of the ever-recurring epidemics. The housing conditions of workers were examined, and attempts were made to remedy the most crying evils. England, particularly, where the greatest number of large
Did we lose somebody? Okay.
I can't hear anyone.
Okay.
Victoria, I think your connection is not good enough to, it's cutting out too much.
Can you finish it, Abiom?
Well, I think the gist of it, is there.
Yeah.
In 1872, when capitalism was at a much earlier stage, we had the phenomena of epidemics, as Engels mentioned, all these diseases that were running rampant among working people in Britain. And of course, the capitalists had to develop some type of way of arresting the spread of these diseases because it interferes, or it did interfere with their profit-making capacity. We see, strangely enough, today, a similar interest in this. Locally, Mike Dugan, who is the corporate imposed mayor of Detroit, said about 2 weeks ago that the city of Detroit is going to have the most rigorous public health policy of any city in the country. Well, why now? We know historically that we've been trying to get a ban on water shutoffs in the city of Detroit, a ban on utility shutoffs in the city of Detroit. a ban on property tax foreclosures and mortgage foreclosures in the city of Detroit because of the potential devastating impact, the actual devastating impact that it has had. Just before the pandemic hit Michigan, people had went to Governor Whitmer, who's a Democrat, and said everybody's water in Detroit should be turned on. And she said there was no high positive correlation between water shutoffs and the status of public health. Well, she had to eat those words within a matter of a couple of weeks, because she did, at least in principle, have to order everybody's water to be turned on in the city of Detroit. So it's a contradiction for the capitalists. Trump, for example, who said that the COVID-19 pandemic was a hoax. Yet, when the stock market started to fall and the capitalists began to lose money and close down their businesses and lay off millions of people, it was necessary for them to develop a task force to address this question. But we know as socialists, the key questions are not being asked or addressed. Now, we just had a debate on the whole issue of health insurance, Medicare for all, national health insurance, whatever variation you want to look at it from. We don't hear that discussion now in regard to the COVID-19 pandemic. So this tells us that within the system under which we live, that it's very, very unlikely that these reforms that are necessary in regard to healthcare, housing, access to water and utilities can be won. We know they cannot be won without a mass struggle. And we know that they cannot be secured without the transformation from a capitalist system to a socialist system. So that was the point in me putting those two citations, the one from Marx, dealing with the necessity of utilizing historical materialism in approaching how we analyze these crises, and also Engels to note how this is a byproduct of the world capitalist system for well over a century and 3/4 of its existence. And even under feudalism, which was overthrown by the capitalist system. So are there any comments or questions about these 2 points?
Yeah, I have a question or a comment.
Go ahead, Austin.
The 1918 influenza epidemic killed a lot of, mostly the working age people, probably because they were all sent off to work. The rest of them may have stayed home. Today, it's killing mostly the old people and the disabled. Do you suppose there's a issue relating to the unproductive people are being killed, so capitalism doesn't give a rip?
Yeah, that could have been the outlook when it first started. It really came to public attention in Washington State, outside of Seattle, where there was outbreak in a senior citizens home, nursing home. But the problem is it couldn't be confined there. It's been disproportionately impacting African Americans, people of Latin American descent, indigenous people in the reservations, but it's not going to be confined there.
A question on that one. It's the death rate on people over 60 or actually over 70 or 80 is many, many times higher than the working age population. Is that also true with the Afro Americans and that's across the board?
Yes. In Detroit, for example, well, in Michigan, African Americans make up 14% of the population, yet we are 32% of the COVID-19 cases and 41% of the deaths. In Chicago, I believe it was like over 70% of the deaths, and this was over a month ago, according to Mayor Lori Lightfoot, were African Americans. But the point I'm trying to make is that even though it was first noticeable among senior citizens confined into convalescent centers, where the workers are largely poorly paid, we have very few benefits, and where the conditions, these are private institutions, and they're not managed properly or administered properly. And obviously the healthcare monitoring left a lot to be desired. Even though it was noticeable initially there, it's moved into key areas of the economy. For example, the meat processing facilities. There have been huge outbreaks in Georgia, in Iowa, in South Dakota, and other areas. These are people who are productive. And that's why they've had to shut down a lot of meat processing facilities. That's why, in part, there are shortages right now developing, and they're talking about instituting rationing of foods in major urban areas. Also, in automotive production, there have been outbreaks. They closed down the automotive plants because several workers were sickened and a number of them died. In the healthcare sector, very productive working class population, nurses, physicians, people who do the janitorial work, the physical and occupational therapists, the physician's assistants, the nursing assistants, and so forth. There have been huge outbreaks. In Detroit, it was reported in the corporate media that over 2,000 healthcare workers were infected with COVID-19. A number have died. The hospitals now, because it is a private capitalist system, are laying off healthcare workers in a pandemic. So it's counterintuitive. So what I'm saying is that you cannot ignore, for example, if the ruling class says, or sections of the ruling class says, well, we don't care if working class African Americans and poor African Americans are dying of COVID-19, that's their problem. Or if people who are in nursing homes are dying, well, they probably would have died anyway. And we've heard people say this publicly, even politicians. It's not going to resolve the crisis. It's moving into deeper and deeper layers of US society. People in the White House over the last 2 days who are aides to the president and the vice president and their family have tested positive. Boris Johnson, the conservative prime minister of England, who's a close ally of Donald Trump, had a very severe case of COVID-19 and almost died. So the thinking that the ruling class has been advancing, it collapses. And I think this is why public health systems were established in Europe and in the United States during the late 19th and early 20th centuries, because not so much that they cared about the health status of working and poor people, but this was a threat to the capitalist system itself. So I think that's the point I was trying to make. Are there any other questions or comments before we move to the last section, which is on the response of the socialist countries and what we can learn from that? Okay. Well, let me just say that socialism provides an alternative to capitalism in a myriad of ways. It's not purely economic, it's political, it's cultural, but also in the healthcare sphere in regard to guaranteeing healthcare coverage for everyone in society, which is what they do in the Republic of Cuba. They don't have national health insurance per se. Everyone is guaranteed the right to health care, which should be the case in any socialist society. And that's why Cuba has trained per capita more doctors than any other country in the world. That's why they have brigades that are operating in many countries throughout the world, even prior to the COVID-19 pandemic. And now, I believe they have 22 different medical teams operating in 22 different states dealing with COVID-19. In Africa, they're operating in Cape Verde, which is off the coast of West Africa, in Togo, which is a former French colony in West Africa, Angola, which is a former Portuguese colony in Southwest Africa, and in the Republic of South Africa, which is a former racist apartheid and settler colonial state. Cuba has sent medical teams to all these countries to assist in the COVID-19 battle. Now, how are they assisting? Some are doing direct, hands-on medical treatment, and others are serving in a consulting capacity and in a training capacity. And I mentioned this in an article that I wrote that was published last week in Fighting Words, the journal of the Communist Workers League, that in Angola, they're training 1,500 healthcare workers in various techniques of doing community outreach. In South Africa, they're doing similar work. In South Africa, under the ANC government, they are doing active and aggressive community outreach to identify COVID-19 cases in the townships, in the communities, etc., which is different from what's happening here in the United States. You have to, well, in Detroit, it's better now, but a month and a half ago, it was very, very difficult for anyone who had symptoms or who felt they had symptoms of COVID-19 to get tested. I've read testimonies from people on Facebook and in other social media platforms who talked about how, even though they were ill, they had to struggle for days just to see a physician, to have a teleconference with a physician, to be allowed to get a COVID-19 test and to get the results of those tests. There are people who have died because they were turned away from hospitals. They had shown up with symptoms and the hospitals would not admit them for care. Some of these people have been healthcare workers themselves. There was a case at Beaumont Hospital where an African-American woman who had worked there for decades could not get admitted to the hospital, and she wound up dying from COVID-19. So this is a big difference in approaches in regard to how under capitalism the situation is approached and how it is dealt with under socialism. Now, in the other citations, I just want to mention them and then we could continue our discussion. We're at about over an hour right now. But there's a citation, the third citation is the transcript of a speech delivered by the current Cuban president, Miguel Diaz-Canel Bermudez, to the non-aligned movement. They had an online special meeting on May 4th. Cuba is a former chair of the non-aligned movement. The non-aligned movement was started in the early 1960s by various countries who were in the leadership of the anti-colonial and socialist movement. It was a movement designed to stave off the potential for nuclear war, which was a real potential of that between the United States and the Soviet Union. It grew out of the Bandung Conference in 1955 in Indonesia, which China attended, as well as other national liberation movements and independent governments in Asia, and the few independent governments that existed then in Africa. And that was in 1955 when you had the Bandung Conference. And then in 1960, 1961, the non-aligned movement was formed with people like Marshal Tito of Yugoslavia, Gamal Abdel Nasser of the United Arab Republic, which is at that time, which is Egypt today, Dr. Kwame Nkrumah of Ghana, the head of the Indonesian government at the time, formed the non-aligned movement. It has been in existence for the last 60 years, actually 65 years if we count the Bandung Conference. So the title of the address was, if we had globalized solidarity as the market was globalized, the story would be different. And that's what the speech was entitled. It was published in Granma International, the official newspaper of the Communist Party of Cuba. Now, we don't have to read the speech. People can read it in its entirety later. But in essence, what the Cuban president is saying is that what is required right now is international cooperation to address this crisis, which is totally at variance with what we hear coming from Washington. President Trump has been first blaming China, falsely blaming China for not sharing information about the virus. He has also suspended funding to the World Health Organization, which is a United Nations agency based in Geneva, Switzerland, which works with all countries throughout the world. They have to balance relations with Russia, China, the United States, countries in Latin America, Japan, the DPRK, et cetera, et cetera. So to suggest that they are biased towards China is really an excuse to deflect attention from the fact that here in the United States, the people that live here have the most cases of any other country in the world. Also, in terms of the World Health Organization and China, China has said in response to these accusations by President Trump that as early as December or perhaps January, they had already sent out the genome, the actual character of the COVID-19, the virus that causes COVID-19, the COS-SARS-2 virus, and that this was shared with the World Health Organization, which in turn shared it with the international community in general. And even the corporate media has gone back and ran clips about how the president said this was a hoax and that it was not a threat to people in the United States. So this is false for Trump to be making these type of allegations against China as well as the World Health Organization. Cuba has provided assistance to various countries, irrespective of their political outlook and their social system. They've sent delegations to Pakistan, Italy. They sent right at the height of the outbreak in Italy. Cuba sent a medical team there. And what's also important that the United States government has not mentioned, there was actually a World Health Organization delegation that went to Wuhan, China, I believe back in January or February, before there were any confirmed cases in the United States. And there were US personnel that were part of that delegation, and they observed the situation in Wuhan and had consultations with Chinese medical authorities. So this is totally false, what Trump is saying, and it's not doing anything to help the people in this country or the international community. So this is very, very important for us to take these factors into consideration. Any comments about Cuba and their role, and also our campaign here in Detroit, which is designed to raise the question of Cuban medical assistance to Detroit, to Michigan and to other cities throughout the United States because we need assistance, but also it's a means of breaking the blockade that's been in effect for the last 60 years. Are there any comments on Cuba and its role?
Yeah, I have a comment. I was speaking about this. Can everybody hear me?
Yeah, go ahead.
Yeah, as far as Cuba is concerned, it's, you know, the United States is not really the reason why they turned down the doctors and medical personnel from coming to the United States. It's not because doctors there are smarter or, you know, the medical personnel are, you know, more educated. It's because of their loving and caring ideology that they bring with them. And this government don't want the people in this country to actually see that and feel that. Because see, when Cuba comes, when their citizens come, they put caring for that individual above the profit motive. So then their concern is not about what it's going to cost. They just go to work and the people see that they have someone that actually cares about them, you know, and will do all they can to heal them, to fix them. And, you know, and so that's what it's really all about, you know. So, yeah, I just wanted to say that. That just came to mind.
Yeah, that's an important point. Very important. And another thing I want to mention as well, the Chinese ambassador to Britain in an interview over the BBC earlier this week, they had two people there from the Trump administration, you know, spitting venom and hailing accusations against China. There was two of them against one Chinese diplomat. And he pointed out that they have shipped over 1 billion items of personal protective equipment to the United States in recent weeks. And the representatives from the Trump administration could not even respond to that. So they're not honest, and that's why we have to. That's why we have to look for alternative forms of information. Because if we listen to Trump, and even if we listen to MSNBC and CNN and the others, as I said earlier, they're not raising the critical questions that need to be addressed right now. This is going to be a long-term issue that we're going to have to deal with as a society. And they can ignore the question of healthcare and public health, but it's going to continue to be a major problem, and it can threaten the very existence of the capitalist system. Because if they're alienating and further exploiting workers in the healthcare sector, in the production process, we have to look at the role of youth and senior citizens as well. There's bound to be a broad alliance of these various sectors of the working class to take on the root causes of these problems, which is capitalism itself. It's inherently exploitative, and that is the real crisis that we're facing now in the United States. Any other comments or questions?
Yeah, I'd like to say something.
Go ahead.
It's not about this last part of your talk in particular, but I think I really appreciate everything you've said, and you've done a good analysis of the situation and going back to the foundational texts and theory. And I haven't necessarily read all of the theory that you linked to, but I have been reading Capital. And it's very remarkable reading that and noting that, you know, with the capitalist ruling class and the coercive laws of competition that dictate the decisions they make as far as their factories and their industries and all that. Historically, there were these instances, and I think that's what Engels is talking about with epidemics and things. But they would initially oppose, let's say, a 10-hour workday, or oppose inspectors in their factory, even at their own detriment, because they can't look that far ahead to see that it would actually improve the livelihood of their workers and thus improve their own livelihood. And the fact that their workers were being worked to death was actually strangling them. But because of their own coercive laws of competition amongst each other, they weren't even willing to allow themselves to be reined in. And it was only through kind of, I have to go back and read it more in depth, but it was almost only out of kind of being dragged, kicking and screaming by the class struggle of the proletariat. And in some cases, strange sort of bedfellow alliances between the agricultural aristocracy in certain cases to try and get back at the new bourgeoisie that was usurping their power. And somehow or other, they end up getting things like factory inspectors and safety regulations and laws passed. And that ended up, and even the 10-hour workday forced them to, instead of extending the workday, it forced them to instead technologically innovate. And then that opened up a whole new avenue of ways that they could create surplus value. And it just expanded capitalism. But it was in a weird way that was just sort of like not planned by the capitalists at all. And I think what you're showing here in a certain way is how this situation now, there's no way for a capitalist system or a non-socialist system to be able to think about what good it would do to actually help people. They don't think like that. So I don't even feel like it's out of a complete like almost like evil or something. It's almost out of stupidity, or I guess it's a debate to be had or whatever. But I don't think that the capitalists are going out and saying, how can we screw over the people more today? It's that they wake up and they don't think about the people at all. And so therefore they don't make the good decision. And then, as you said, the meat workers do get harmed. Of course, maybe people on the margins are most affected and the capitalists don't even notice, but then their actual productive workers end up getting harmed and killed. And then they do notice what's going on and it does affect them, but they just are incapable of coming up with a plan collectively, because they're actually in competition with each other, and they just don't plan. This non-socialist countries don't make plans. So I mean, it's in this situation, it's just become so abundantly clear who is good at handling an epidemic, and it's clearly socialism. So I think it's just like, I just keep waiting for the day when everyone is just going to say, wow, man, we really screwed this one up. But like, for some reason, China and Cuba didn't, and Venezuela, every time I go and look at like numbers that I can find, even in South America, I think Brazil is going like this and Venezuela is like that, So I don't know, that's all I wanted to say.
Yes, this is a major problem. You mentioned industrial capitalism during the 19th century. This happened also during slavery in the United States and the Caribbean and Latin America during the period all the way to just about the end of the 19th century. And today we have a situation where healthcare workers, we can see on television where healthcare workers are being applauded. And you were in New York, you saw it firsthand, but at the same time, they don't have the PPE that's needed. They're not being paid adequately. And those who speak out run the risk of being terminated. So this is the contradiction that we have to deal with. Here in Detroit, there have been resistance efforts, sit-ins by nurses and healthcare workers. Amazon, there was a demonstration there. Nationally, on May Day, they were calling for a sick out, whether people can afford it or not. These are all important actions. The UAW has issued statements about the plans to roll out or phase in auto production. That's going to be starting Monday, May 11th. The problem is, if there's another upsurge in outbreaks, they'll have to close down again. And that will, of course, complicate the purported recovery even further.
David, go ahead. David has his hand up.
Oh, David, go ahead.
Yeah, so I think it's fair to say that natural disasters, and this is, aside from the social aspects of it, this is a natural disaster, is exposing a lot of irrationality in the system, in the capitalist system that we're living in especially. And that is an opportunity for people to start thinking about what a rational system is. And we've given that a name, socialism. And I think people are going to be open more and more. This is not going away. If anything, this will intensify whether people get back to work. This thing is going to be rolling along for quite a months and years. So the opportunity is going to exist for people to be thinking new thoughts. But there is, of course, there's two aspects to that. One is some right-wing and Wall Street forces are going to try to put certain thoughts in their heads. And we saw that with the militias up in Lansing. I had to laugh. How many times did we go to Lansing and state police refused to allow us in the state capitol with signs, picket signs, posters, banners, but guns? Oh yeah, you can go in there if you're a right winger.
Yeah.
But more than that, these people consciously or unconsciously were promoting the Wall Street program of get back to work. We demand the right to go back to work. And they reflected a certain amount of feeling that any worker would have. Yeah, we want to get back to work, but any thoughtful person will know that you can't just rush that. And so, but the Wall Street gang and the neo-Nazi types are going to be promoting their ideology to try to penetrate the masses as they start to question the system as it is now. So the question then becomes, how can we get out a program? We can call it a socialist program or a mass program that answers this. And Abiyumi, you laid it all out there, and we can summarize it, at some point with a 5-point or a 10-point program about housing security, water security, food security, medical care, job security, a scientific approach to pandemics. This can all be laid out. The problem is that the radical left, communist, socialist left, the communist left is fragmented, and getting out a program is really hard. Even if we get off of this Zoom and get back in the streets, it's hard, and we are fragmented. There are many different groupings, and there's a broader socialist, moderate socialist movement that's emerging, and but we don't really have, there's not an organic link between the communists and the socialists. We have to think about how to bridge that. And so this is some of the challenges, I think, that we really have to give some thought to in the coming months, because we need to be able to go out with some kind of a national program, and we don't have, definitely here in Detroit, we don't have that. We have alliances, and I'm not downplaying that. We have alliances with a lot of good groups and individuals, and we try to approach it in a non-sectarian way. But the task is much greater than our resources and right now in this country. Thank you.
Jason has his hand up.
Okay, I just want to say a few things. Number one, I was in New York at hearing, and you were mentioning the clapping that would happen every evening at 7 o'clock. I happen to have been staying in a fairly affluent area in Manhattan, and when I heard this clapping begin, there was something that just started to strike me as funny about it, and I couldn't put my finger on it at first, but I thought back that when the virus first hit Wuhan, there was video footage of people in high rises clapping. Of course, at the time, they were people in the West were putting ominous music behind it, and they were saying that the people were screaming in fear, but that was a lie. They were shouting words of encouragement to each other. I also, even in Italy, the same thing happened. They were singing to each other. But it was what was struck me as strange. I finally realized that in the U.S., it was one group clapping for another group. Unlike in China, and also apparently in Italy, the people kind of giving each other words of encouragement. Here, it was that the people that are quarantined, and this is a very rich area where, that I was in, the people that are at home quarantined and doing, telecommuting to work are clapping for the brave frontline workers. And yeah, like you said, I think it's purely this kind of like, thank you for being a hero. And at this point, we're starting to become aware of the fact that, these thank yous are just sort of empty, because we're not actually taking, and those people are being coerced into being in the front line because they have to be, because that's their job. They're not choosing to go out heroically. Another thing I wanted to say really quickly is, I agree with David talking about the fact that socialism is what we are putting forward and having a program. But it's important, once again, to say that with all the Bernie socialists, the people that define socialism as social democracy or just sort of a welfare state, we need to make sure that as we talk about the kind of socialism we're talking about on this call about Cuba and China and countries like that, like people are still going to be thinking, well, how can socialism fix this problem? They're going to be thinking through like a social democracy lens. So we should like really try to make that distinction for people, because I think those people are lost right now. Bernie dropped out, their heads are spinning around. There's like, what is going on? And then the last thing I just wanted to say is that for putting forward a program, and this is my own experience, the best possible way to put forward a program that really sinks in for people is to make people aware of internationalism and other countries and what is going on in other countries. We could put together a program that says we're going to have Medicare for all, we're going to have guaranteed jobs, we're going to have guaranteed housing. But if you just say, look what they do in Cuba, that's already successful there, or look what they do over here, that's already, even Bernie would say, why are we the only developed country that doesn't have Medicare for all? So even he used that tactic of just trying to get Americans to look outside of their own borders, which they're so bad at doing, to say like, there are other countries that are screwing this up. And now this is the best opportunity, because we're clearly have the worst result of COVID-19 in the world. So obviously, if you even are able to look at that and just look at any other country, then you can't really deny that there's a better way. So I think internationalism is my way of making that clear to people.
Yes, I agree. And let me just mention that the last two articles that are cited in the event page, one deals with cooperation between China and Cuba, and the final article deals with the Cuban Henry Reed's medical team that arrived in South Africa on April 27th. So people can read those articles, after this class, at their own leisure. But I think it's important to uphold these examples. The non-aligned movement, the speech by President Diaz-Canel, and also the cooperation between China and Cuba, which is also extended to the development of a vaccine to prevent COVID-19. Those efforts have not gotten any publicity here in the United States. And also South Africa, because of the historical connection between the African National Congress and the Cuban Communist Party and Cuban government. I think most of us know, but just to mention that Cuba is an African country in the Caribbean. Castro said in regard to Cubans, we are African Latin people opposed to racism, capitalism, and imperialism. He said this back in 1975 when he sent 55,000 Cuban, all volunteer internationalist forces into Angola in Southwest Africa, where they have a medical team there now. They were deployed there to fight the racist South African Defense Forces, which wanted to halt independence of Angola under the MPLA, the Popular Movement for the Liberation of Angola government, which was a left-wing Marxist-Leninist-oriented government in 1975. So the entire imperialist world was against the MPLA, and Cuba sent forces in to defeat the South African Defense Forces and drive them back from the capital of Luanda. And Cuba kept forces in Angola from 1975 all the way up to 1989, when there was an independence process initiated in neighboring Namibia, which was also a settler colony of the Republic of South Africa, which was backed up by the United States and other imperialist countries. Cuba also intervened during the Ebola virus disease pandemic of 2014 and 2015. They sent healthcare workers to Sierra Leone and Liberia. There were thousands, tens of thousands of cases. Many thousands of people died as a result of Ebola virus disease. And Cuba played an outstanding role in the process of arresting that pandemic. To the extent that even the United States, under the Barack Obama administration, had to comment and had to recognize the important role of Cuba in fighting the Ebola virus disease pandemic. And I think what David said is important in terms of this being a recurring natural disaster or natural phenomena in terms of epidemics and pandemics. Because what the right wing is saying, and what we have a lot of it in social media through so-called conspiracy theories, that this is somehow a result of the 5th generation cell phone and satellite technology that China is leading in internationally. They make the connection between 5G and the breaking down of human immune systems, which the Chinese or someone release this virus into the general public. All these theories, and the theories about Bill Gates and the promotion of a vaccine. Well, Bill Gates is not the only person advocating the development of a vaccine. They're also working on it in the socialist countries. And even going back to the Soviet Union, they had to deal, even in Lenin's time, they had to deal with the spread of infectious diseases. So this is not something that's unique to this period. That's why we are historical materialists. That's why we use the dialectical methodology to understand natural phenomena. And that it's up to us as humanity, using our reasoning capacity, our capacity to solve problems and to improve society and to overthrow injustice, that we approach the whole question of a COVID-19 pandemic. To say that it is a biological warfare weapon does not provide any answers to the crisis. Let's say it was, then how do we solve it? How do we arrest this phenomenon? So these are very, very important things, because when people make those type of arguments, they end there. They don't go beyond that to say, how do we solve the crisis that we're in right now? How do we make sure that Black people in Detroit have health insurance, that they have quality education, housing, that they have clean running water. How do we deal with those questions? We have to organize, we have to do political education, we have to mobilize the people, and we have to develop a program. That's the only way we're going to reach those objectives. Because otherwise, the danger is that we overemphasize the dominance of imperialism and capitalism, and it can become demoralizing to suggest that the exploitative system is beyond repair or out of the reach of our capacity to transform it. And we know from studying history that is not the case. We lived under slavery for 2.5 centuries in this country. There were slave revolts periodically during that whole time period. There was a civil war that legally ended slavery. It took another 100 years to at least give some semblance and guarantee the universal suffrage in the United States. But we're still not at a point where we have full equality, let alone self-determination for the oppressed. Russia was a highly exploitative, largely agrarian, backward, feudalistic society. Yet it was the scene of the first socialist revolution, the first Soviet government in history that broke with the legacy of capitalism, feudalism, and slavery. China, for example, the people were highly underdeveloped and oppressed and exploited. Yet the Chinese Communist Party was able to organize. It took decades, it didn't happen overnight, to fight the reactionary Japanese imperialists, the collaborators within the Chinese population, and even US imperialism during the Korean War. They played a decisive role in defeating US imperialism and maintaining the sovereignty of the Democratic People's Republic of Korea. We reference South Africa, Southern Africa. I'm old enough to remember people saying that the African people would never defeat the whites in Southern Africa. They didn't have the capacity to do it. The colonial governments had more weapons. They were backed by the US, they were backed by Britain. Well, that did happen. But today we face new challenges, but I don't think they're beyond our capacity as human beings to resolve. So I just wanted to mention that the last two citations in the Facebook page event, people should read and continue to read these documents because we have the basis for resolving these problems. And no one should be in a position to tell us that this problem cannot be solved. It can be solved. We just need the right system. We need the right organization and the right methodology to carry out, to actually be able to challenge what the problems that we're facing today. So I can end right there. And if there are any other questions or comments or observations, go ahead. We have about another 15 minutes.
Austin's got his hand up.
Go ahead.
Yeah, in one, I don't know if you said it, but in one of the things that you put out in your 10-point plan, wage increases, and especially for all the frontline workers, would be a good idea. I mean, even the House of Representatives is pushing that forward. It's kind of a question of what's going to happen in the future. The capitalists, of course, think that all these unemployed mean maybe wages will go down. I'm not so certain that's true, especially with the unemployment insurance actually paying a number of workers more than they got before. And you got 6 months of people they're already not saying, I don't want to go back. I got 6 months of better pay. It's ridiculous. And so wages have to go up. And especially for the frontline workers, I think they're talking about $25,000 a piece. I don't know if that's just for the doctors or some sort of maximum, but that would certainly be an important part of a 10-point plan.
They should. And it should bring stability to these job categories. You look at the production workers in the food processing industry, whether it's agricultural or the meat processing. They're paid poorly, they're heavily exploited. The safety and health conditions are extremely poor. Over a month ago, I saw down in Georgia, they ran a report on one of the cable news networks showing mainly all African-American workers walked out of a plant in Georgia saying that the conditions, they quit. They said the conditions were too unhealthy and they were not safe, that there were people in the plant on the line who had been exposed to COVID-19 and they were still working. And they had not cleaned up the plant. So this is a major problem and that's going to continue. I just wanted to make one other observation. Jason and David raised the question of social democracy. And I think it's somewhat of a tragedy that Sanders withdrew from the presidential race at this time of the pandemic. Because in our opinion, and I don't know what he was looking at. He was looking at the fact that he said there was no clear-cut path to victory. But the problem is that at this point, it may not make a difference, a decisive difference in terms of who gets how many votes between now and November, considering the social and economic conditions that exist in the United States. And he withdrew at a time, in my opinion, that he could have played a very, very important role in terms of policy addresses related to the imperative of national health insurance in the United States, the need for minimum annual income. Himself and even Ilhan Omar from Minnesota, they had put forward a proposal to have a guaranteed annual income. This is what Dr. Martin Luther King Jr. was talking about back in 1967 and 68. It's one of the reasons why he was assassinated, in my opinion, because he wanted to bring this into the mass arena, that we should eliminate poverty in the United States. He said we had the capacity to do it, and it should be done, along with ending the Vietnam War and other imperialist adventures. So Sanders could have played, I think, a role all the way up to at least the Democratic Convention, which will probably be virtual, by raising the question of healthcare, the need for a guaranteed annual income, to step down and then endorse someone who does not support national health insurance, who said repeatedly that people should be allowed to keep the health insurance programs which they like. The problem is those programs are associated with their employment. And if there are 34 million people out of work in the United States right now, that means a lot of people are going to lose their health care coverage. And someone who, in fact, Joe Biden, who's never seen a war he didn't like, who's never seen a corporate bailout, bank bailout he didn't like, and who has a lot of baggage in terms of gender relations and other issues, racism. I mean, his position in the 1970s on busing, his posture towards Clarence Thomas. He voted in favor of Clarence Thomas. He voted in favor of confirming him as U.S. Supreme Court Justice. Went after Anita Hill, who had accused Thomas of sexual harassment. And I think these issues will come up during the campaign. So, it's going to be very interesting the next few months.
Mike?
Just a minute. Sharon has her hand up.
Yes.
Okay. It's really hard to talk into this, to talk into my tablet. So can you guys hear me?
I hear you.
Yes.
We see you clearly.
Oh, okay. Okay. So, the first thing I've been listening, so these are sort of a lot of different comments I'm squishing together. So the thing I was thinking about is the propaganda of capitalism, how it's like a delusion that people believe, you know, and delusions are hard to break through. And one of the things that makes this pandemic different than the Spanish flu, 1918 flu, is the social media and knowing there are so many people that their lives have been so disrupted and hurt that I think that sort of puts a wedge in that delusion of how good capitalism is. I think people are seeing it more as a broken system than ever before, which gives us a chance to do something different. That's one thing I'm thinking. The next thing I'm thinking, oh shoot. Okay, the thing is when I went to Nicaragua, I I was so profoundly affected. It was during the revolution by the communist system being, you know, taking around and seeing it. Now I had been in communist classes. I was in Solidarity before I went. I had done readings and I understood things, but being in that system and experiencing it opened my mind in ways that I don't think could have happened here in the States. And one more thing, being with all of you and learning really has opened my mind about racism. It was being around people who really spoke and opened it and took me down to the bottom of it, you know, to really understand it and continue. I'm still continuing to try to understand it. And when Mario Cuomo was making his one of his events on, you know, his live events, he said, "Well, we're going to have to study this incident of why so many Black communities are so effective. We don't we have to understand this." How could he not understand it? I mean, it's so obvious, and all these people were saying we have to study it. It was right there in front of them, and that they were saying that. It was outrageous. So, okay, so what I'm trying to say is we do need a program. We need a way to get people to really understand what a socialist state living in it would be like. And we need to, I don't know, we just need to teach people. That's all I wanted to say.
Thanks.
Yeah.
Okay, go ahead, Chris. And then after that is Austin.
Okay.
And then Sharon.
Okay. I just wanted to say that, just wanted to ask, why is it that Cuba and China are so being slandered today by the ruling class, and by their minions, both in the Trumpists and the Democratic Party leadership, by Biden and Trump, basically. And the reason for that in this pandemic crisis is that both countries, socialist countries, have succeeded in controlling the pandemic within their borders. Avi only mentioned that their brigades that Cuba sent to Africa and Latin America and other places not only gave direct help, but consulting. This is what makes them so dangerous, because they're consulting on the basis of a social system that's far more advanced than the U.S. capitalism can offer. And so what the U.S. ruling class is doing today from their media and everything else is to cover up this success. Why is it that China, which was the epicenter, the beginning of this pandemic, where it had to be discovered, where it had to be researched, where it had to be found out how communicable it was. Why is it that they have been able to, and without yet developed vaccine and without a cure, have been able to control it so successfully and so quickly, whereas the U.S., which has been floundering and has now had skyrocketing rates. And I think one of our roles is, and I think it was splendid to bring in this initiative with Cuba, is to put out to as many workers as possible, our class and oppressed as possible, that the reason for that they want to hide is because they were able to use methodology and mass mobilization based on a worker state, based on a dictatorship of the proletariat as its engine, to be able to counter this pandemic. And that social system is what we need here. This pandemic has exposed the weaknesses of this social system. And I know we're small, and right now we have all kinds of obstacles, but that's the message we have to carry.
Thank you.
Okay, I want to call on Sharon because she hasn't spoken yet, and then we can go with Austin. Go ahead, Sharon.
Said about Sanders, because I have to confess, I had what turns out to be an illusion that maybe he could help lead us in a new direction. And I've come to the realization that coronavirus has flushed out all the illusions and the lies within all of our systems, including the political system, where it appears that he was pressured or responded to pressure for his career. And Pelosi and the centrist Democrats basically put him in told him he'd be like, quote, Ralph Nader. He'd be Ralph Naderized for telling the truth. He'd be excluded from power in his career. And so at the very time that his program was beginning to make ultimate sense, even to people who wouldn't have even thought of it before, is when he withdrew. And I think that's when the pressure came in and, forced, he had a choice, but, he felt the pressure and withdrew and sank back into the system. I saw a show last night, Jimmy Dore show, and he talked about how the leadership, he pointed out all the wildcat strikes and the potential general strikes coming from labor, and that's where we need to look for leadership now. And he said it's outside of the union structure. He said if you organize a union, it takes years to have an election, it takes years to collective bargaining, and then you have to file grievances, and then the National Labor Relations Board, which is mostly Trump appointees now, you'd probably lose. But they're taking their problems direct action in the workplace. Amazon, Walmart, Target, and the fast food workers have gone out on strike. Not enough to shut down the whole thing, not a general strike, but it's a different kind of strike because it's widespread, it's national. It's not just one local workplace where they're going on strike. And he said, if that continues to grow, that's where the potential for change is, he thinks, or for leadership, that there's no longer the political system has run its course within capitalism. We're done. That's reached its end. And the other thing I wanted to say is to Sharon Feldman. I went to El Salvador back in 1991. It was toward the end of the war there. It was still going on. And I saw what was happening within the FMLN, and that was a mind-changing, soul-changing experience for me that might have been similar to what Sharon's describing. The whole attitude of cooperation and caring for each other, and the medical, all the systems were community-based and created, organized, and controlled by the people. And I saw that in a way that I could have read a million books or speeches and not understood it on that level of what I saw there. It was profound. And I just wanted to say that. And thank you, Abayomi, because my soul is craving information about coronavirus and how the systems are crashing and collapsing all around us, even clashing with themselves, as you pointed out, the internal contradictions. And it's just, the way I see it is this pandemic is just shining a light into the darkest corners of capitalism, that it's hopefully going to cut through the brainwashing and the propaganda, which they're churning out at prodigious amounts, but it seems it's like it can't be ignored. It can't be ignored anymore. So thank you.
Thanks for tuning in.
Yeah.
And Austin has his hand up.
Yeah, thank everybody for your comments. I did have one other item that should be put on the 10 points, I think, and that's related to the capitalist system is proving itself to be bankrupt at all levels. And I think if it was shown that we are actually fiscally responsible by stopping all the massive defense spending and wars, taxing the rich, and businesses that are profitable, they get taxed too. I think even the businesses will go for that because the majority of them are making money. They don't care if the rich guys, the guys who are making tons of money out of this system, do pay. So I think there's a way to make it so that it's all fiscally responsible. We don't look like people or a group that is saying, hey, we're a bunch of social welfare guys who say, don't work, we'll pay you. This is related to everybody gets a good wage. Those who have more money pay more taxes, and in the wars, that pays for most of all the systems that are being proposed in the other points. Also, I had one final question, I'm sorry, before I tune out, and that is related to the Cuban doctors. When they go across the world, have any of them contracted the disease themselves? Do they have a casualty rate at all from coronavirus or any of the other viruses?
I have not heard of any of the, like the Henry Reed's medical brigade, of any of them getting sick. I have not heard anything about it. But in some of their missions, they are in very dangerous situations.
Do you suppose do you suppose they're not? Go ahead.
And also, well, militarily in the past, I mean, they lost people in Angola.
Do you suppose if they're not getting sick, it's because they're better protected, they're more cautious, they're better trained to be able to deal with all this, they have more experience?
Could very well be the case. I think in this country, if the physicians and the nurses and other people have been given the PPE that's needed, if they had adequate staff, that a lot of these deaths could have been avoided. But anytime you put profit before the health and safety of people, we're going to have a lot of problems in that regard.
David has his hand up.
Before we end, I just wanted to let folks know there's a class next Saturday. Abayomi will be leading a discussion of an interesting work by Walter Rodney, about which he wrote about the Russian Revolution. And that's going to be at 2 o'clock, if I'm not mistaken. And everyone's invited, and bring a friend.
Yeah, well, I want to thank everybody for taking time out to participate in this discussion. And if we can share this, it would be great. Once it's done, either on YouTube or whatever, so other people can view this class and discussion. And yeah, we got to keep working at this this new technology until we can, move on, or, not move backward, but move on in terms of our organizing work. I know it's a challenge for a lot of us because we're the type of organization that, we like to get out in the streets. This is what we do. The picket lines, the mass leafleting, the organizing meetings, the mass meetings, all of that, organizing in the unions, in the educational sector. So we have to adapt. We have to adapt to the new situation.
Should we, is that it? I'm sorry, my video cut
Thank
out.
you. What about clapping? And thank you.
Okay, thank you for tuning in. All right, thank you.
Thank you.
Thank you.
Everybody have a nice evening.
You too.
Yeah.